Hello there, this is Dr. Bernard Willis from the Optimal Wellness Centre in Auckland. I'd like to talk to you today about underactive thyroid or hypothyroidism. Many of you probably won't know that the thyroid actually sits astride of the neck, just below the Adam's apple, and it produces two hormones, T4 and T3. These govern the metabolic activity in the body, so if they're reduced, then the body's going to have a low rate of activity. You're going to feel sluggish, maybe tired, depressed, low motivation. You're going to feel cold, even in the summer. You might find that your skin is dry, you may be constipated, you can lose hair, or hair can be thinner. And you may even notice, one sign we look for is that the lateral third, the outside of the eyebrows, can be missing quite often. That's often a sign. Okay? You can have muscle aches, you can find it very difficult to lose weight, because obviously the thyroid is the thermostat of the body, so when it's underactive it's not going to burn off the fuel, so you're not going to lose weight very well. It can also affect your nails, and nails can be brittle. It can also affect your cholesterol levels. You can have a high cholesterol with low thyroid. In fact, before, millions of years ago, when I first started in my career, there was no test for thyroid at all. We used to test cholesterol levels. If cholesterol levels were high, then we assumed the patient had an underactive thyroid. And the other thing it can upset your periods. It can make your periods are longer or shorter or heavier. Much more common in women than men because of hormones. A lot of women these days are estrogen dominant. I'll be talking about estrogen dominance in a future presentation. In other words, they have high levels of estrogen compared to their progesterone levels. Progesterone balances estrogen effect, and it's simply because as women approach the middle age, they stop ovulating. So when they don't ovulate, they don't produce progesterone. But the estrogen level carries on and carries on. And we're also bombarded these days with environmental estrogens from PCBs, pesticides, BPA and plastics. They all have an estrogen effect in the body. So that's why it's more common in women. It's how do you get it under? What happens? So firstly, stress. Back to stress again. Stress can cause it. It can crash your thyroid, because when you're under stress, you produce too much of the adrenal hormone, which I spoke about last time. Cortisol, which can go up in level in the blood, and this affects the thyroid hormones too. And progesterone will correct that too. Okay. And the other most common cause of underthyroid is something called Hashimoto's disease. This was discovered by a Japanese doctor called Professor Hashimoto many years ago. It's an autoimmune disease of the thyroid. In other words, it's one of these diseases, there are many that we suffer from, in which the body looks upon its own protein as a foreign substance and attacks it by producing antibodies and inflammation. The actual name is autoimmune thyroiditis. And what can happen with that can destroy the thyroid gland and produce low thyroid hormones. Iodine deficiency used to be, in the old days, one of the most common causes of underactive thyroid. People used to get goiters, swelling in the neck, particularly the classic one is the Derbyshire goiter, when the iodine levels were so low in Derbyshire that a lot of people got swollen goiters. Nowadays it's iodine deficiency because it's in salt, and a lot of us eat some sea vegetables, seaweed and sushi. It's not quite so common, but very often if you have an underactive thyroid, and if you test the iodine levels are low, you can actually improve your thyroid just by replacing iodine. The other thing in this day and age is that toxic metals, toxicity from arsenic, lead, cadmium, mercury can all cause problems with the inflammation in your thyroid. Poor diet does it again. Gluten particularly is toxic to the thyroid. So again, if you have underactive thyroid, it's better to go gluten-free and try and go into an anti-inflammatory diet, a diet with less sugar, less refined carbohydrates, and more fresh fruit and vegetables. The so-called rainbow diet, as many calories as you can for fruit and vegetables. Okay. So how do you know if you've got it? How do you test for it? Well, you can have a blood test. You can test thyroid hormones. You can test T4 and T3. And we also test something called TSH, which is a hormone that is produced by the pituitary gland, which tries to kick-start the thyroid when it's not working. So your TSH level will likely be high. But you must bear in mind that these tests are not very accurate. You can have an underactive thyroid with normal blood tests, So I prefer to listen to the patient, examine the patient, and use the blood tests as a sort of backup, to back up my own clinical judgment. One of the best tests I use often is to get the patient to take their temperature in the morning, basal temperature we call it. So as soon as you wake up in the morning, before you put the kettle on, get yourself an old-fashioned mercury thermometer, okay, shake it down, pop it under your arm, and leave it there for 10 minutes, okay, and then you can record the temperature over 4 or 5 days on either piece of paper, or we have special charts in which you can do that. If your temperature is consistently below 36, okay, then you're likely to have underactive thyroid. The adrenal glands can also cause a low temperature, but that tends to have a different pattern. The temperature tends to spike up and down like the Himalayas, whereas in thyroid disease it tends to be consistently low and flat on the chart. So the other thing you can test, obviously, have your hormone levels tested. Your adrenal glands and thyroid gland are very closely interacted. Have sex hormones tested, your estrogen, progesterone, testosterone. These also are very important because hormones in the body work in harmony. We call it hormone harmony, and they have to be interlinked, and they all have to work together for health. The other thing you can do, you can have a test for toxic metals. That can be done through hair or urine, and food allergies also can be tested. They can be tested either by using an elimination diet or by having a blood test for 96 to 100 different foods, which can be arranged through doctors' data in America. Okay, so once you've been diagnosed with an underactive thyroid, what do you do? How do you treat it? Now, certain foods can help. It's a good idea to have foods with containing a little bit of iodine, like seaweed, sea vegetables. Kelp is good, or nori or wakame. These are Japanese seaweeds. Fish, some sea salt, and omega-3 fatty acids. All these things help to boost the thyroid. Foods to avoid are calciferous vegetables, particularly if they're raw, things like cauliflower, Brussels sprouts, cabbage, those kind of vegetables, because they can actually damage the thyroid. But if they're cooked, then there's not a problem. It's just eating them raw. Supplements that can help. The important thing for thyroid is zinc. It's very important. Zinc is necessary for 300 different enzyme reactions in the body. Selenium is anti-inflammatory, helps the thyroid. Copper, likewise. Tyrosine is used. The amino acid tyrosine is used in the formation of thyroid hormones, and so is iodine. Iodine actually is in the molecule of the thyroid hormones. So the other thing to do is if your hormones are low, is to use natural progesterone. That will increase the level of thyroid hormone by reducing the effect of estrogen in the body. And that may be enough. The diet, the supplements may be enough in iodine, may be enough in some people to restore the thyroid to normal. If not, we can give you the thyroid hormones. A conventional doctor will probably just give you T4, which is known as thyroxine. It's a synthetic. But the problem with T4 by itself is that it's only slightly active in the body, and to work properly it has to be turned into T3. T3 is the active hormone. So some people don't have the right enzymes or the ability to convert T4 into T3 effectively. So you can take as much T4 as you like, which is thyroxine, and you don't feel any better because you're not converting to T3. So what holistic doctors tend to like to do is to give the whole thyroid extract. This is extracted from pig's thyroid, and it contains both T4 and T3. And it's far more effective because it gives you both hormones in a 4-to-1 ratio, and that is more effective than one but the thyroxine by itself. And what we do then is we titrate, we increase the dose depending on what your body temperature is doing. You can take your temperature 2 or 3 weeks after a certain dose of the whole thyroid and make sure that your temperature is rising. Once you get into the normal area, then that means your dose of thyroid is correct. Blood tests, we obviously follow blood tests up, but they're more important to make sure that you're not actually overdosing on thyroid. You know you're overdosing if your heart rate starts to increase, or you get a bit trembly or stimulated or wired, then you know perhaps you've had a bit too much thyroid. But any good holistic doctor can monitor your treatment and make sure that you're your thyroid gland recovers both with diet, supplements and, if necessary, thyroid hormones.